All right, thanks, Rich. Well, April is designated as Autism Awareness Month, and as the numbers grow, many parents worry. They try to learn more all the time, and we're joined now by Dr. Michael Sevilla for more on the topic that's on everyone's minds more than just 1 month out of the year. The numbers do seem to be growing every year. We hear the reports. Why is that?
I think part of it is just a better education about it. People are learning more about it now, so it's recognizing it earlier. I think the definition also has expanded maybe a little bit, and we're knowing now more. It's a spectrum of symptoms. It's diagnosed at earlier and at later stages in infancy, so I think that's part of why the numbers are growing. About 1.5 million kids are on the autism spectrum, we now know.
Wow, wow, and some are very serious, and it's considered it's more of a disability and difficult to get them to communicate, and all the way up to like an Asperger's where they're pretty functional, but just have certain certain situations. Can you tell me a little bit more about where we stand with, I mean, they don't really know the cause, the definitive cause, and that's what has most parents so baffled. They're looking for a reason, What are some of the, what's the latest research showing?
Well, we're finding more that there's a genetic link. For example, we're finding now that about 1 in 110 children are diagnosed more common in boys than in girls. We don't know why, so that's kind of part of the reasons why we're finding the cause of it now. And treatments, they're basically concentrated on working with your educator and some behavioral type treatments as well. So, but it really varies on the child and what their symptoms are.
And the severity of the symptoms. What's the best advice for a parent if they're noticing things? It's hard in the early stages, but they say the earlier the better to get a diagnosis. So what should you do?
Well, the first thing is to talk to your doctor about it, and because I know as a doctor that if a mom or a dad or guardian comes to me and says there's really something that doesn't look right or feel right, or this child didn't act like my other children, just to kind of talk to your doctor about that and just kind of talk that out. The first thing is to talk to your doctor about it.
The things that you're noticing, maybe delayed speech, some of the precursors, delayed speech.
Yeah, there's some delayed speech, there's some delayed with milestones, there's some delay with motor function. So any of those, definitely talk to your doctor about.
Now, we also talked about, there was a link that many parents would go back to. They think that perhaps immunizations are somehow in connection with autism. Do we see that anymore? Are we hearing less of that?
There was a study that came out about 10 or 11 years ago saying there may be a link between a certain immunization and a development of autism. And during that time, the autism numbers did increase. But about a year ago, the researchers came forward and said, well, the data really isn't that great. We're going to withdraw our claims. We don't think that there's a link between immunizations and autism. And I think that's very important for people to know.
Yeah, parents should be aware of that. And I think a lot of the autism advocates and people who are out there trying to, like Autism Speaks, they've kind of backed away from that idea a little bit too. All right, well, we're going to talk to you further in the next hour as Autism Awareness Month. More topics and so on to help parents out there to diagnose and figure out what's going on.
Okay, great.
Thanks. Coming up next on First News This Morning.
All month we've been honoring autism awareness, and we'll welcome in Dr. Michael Sevilla for more on how this month is playing out. That's coming up after this.
Thanks, Steph. All right, well, you know, April is Autism Awareness Month. It's a disorder that's affecting more and more kids, so new research is always in the works. First News contributor Dr. Michael Sevilla joins us now with the latest information. Good morning, and thanks for being here this morning.
Good morning, Amy.
It does seem that more and more parents are affected, and an extended family. There aren't too many families around that don't have someone that they know who's affected by autism. What can you tell these parents as far as the research that's being done and how close we're getting to maybe solving some of the problems?
We're learning more and more about autism. We're learning more about the symptoms. We're learning that autism is a spectrum, meaning that there's a lot of different symptoms that can be more severe or less severe, and there's definitely more research going on as far as what the cause is, and which leads to some treatments.
Some treatments. And we've heard before, again and again, early diagnosis, early diagnosis. How early should you really be paying attention and looking for something that might be wrong?
Definitely, parents should, one thing is to keep track of milestones. There's a lot of different lists that are out there now, or even using the kids that they've had before, as far as when did they start talking, when did they start walking, when did they start babbling, those type of things. So definitely should look at those type of landmarks or milestones to see if something is just not right.
Okay, now once you get a diagnosis of autism, what types of things can a parent do to maybe help the situation? You hear a lot about, lately especially, about nutrition and how a lot of moms with autistic kids are using different kinds of nutrition to try to help their child. Do you see much research in that, and that it's working?
There's definitely research that's ongoing for autism. We haven't found anything definite yet, but I have read some studies on some theories that people are having with certain type of nutritional treatments for autism.
Okay, and which you might be able to do. Once you get them into a program, how do you know what to look for even with that, with a program that might be good for your child? Is there a benchmark or anything to some of the questions parents should be asking maybe?
Well, what I've seen the best is for parents to get plugged in with other parents, and there's a lot of support groups, even online support groups out there, or even getting plugged in with Children's Hospital. They have a lot of resources, and they have a lot of experience in diagnosing and treating kids with autism, so that's definitely where I would go to first.
Any major misconceptions you think that are out there right now about autism that need to be cleared up?
The main thing is the issue with immunizations. There was a study that came out about 10 years ago stating there might be a link between a certain immunization and autism. The study researchers came out about a year ago and saying, there really isn't a link. Our data wasn't really that good. So the bottom line is for parents to remember is that immunizations are not linked to autism at all.
Yeah, you don't want parents to be afraid to immunize their kids.
That's right.
Okay, thanks so much for being here. And remember, it is Autism Awareness Month this month.